going to wash my hands with the alcohol. Okay. My name is Christy and I'm an NSU nursing student. I'm going to be taking care of you today. Could you please verify your name and date of birth?
Penelope Ivey, 10/8/1947.
And do you know what we're seeing you for today?
I fell about a week ago and hurt my right leg just below the knee.
And do you know where we're at?
Natchitoches Regional Medical
And
Center.
do you know what day it is?
It is Wednesday, September the 17th.
Okay. And the next thing I need to know is, can you tell me why you're here again?
Because my leg is giving me issues.
Okay, and when did it all begin?
About 7 days ago.
And exactly where is the pain located?
Okay, it's located right below the kneecap and in kind of towards inguinality.
And when it hurts, could you tell me how long the pain lasts?
About 10-15 minutes.
And can you describe the pain?
Well, it kind of like bone on bone, rubbing, kind of like if you have a shin splint, you know, if you walk a lot.
And is there anything that aggravates the pain?
Going up and down stairs.
Okay. And does anything relieve the pain?
Well, I take some ibuprofen and that helps to relieve it, and I'll sit down and prop the leg up and that relieves.
Okay. And on a scale of 1 to 10, can you tell me what pain level you could?
8.
8. Okay. And so the first thing I'm going to do is I'm going to raise the bed up. Okay, I'm going to leave the rail up for just a minute until I go to sit you up. But first thing I'm going to do is I'm going to check your eyes real quick. So I need you to take your glasses off. And I'm going to let you first tell me how many fingers I'm holding up.
2.
Okay, and I'm going to check your eyes. I'm going to use this light. Just look straight up. Okay, and now can you follow this? Okay, and now could you open your mouth for me? Okay, all right. And can you stick your tongue out? And can you grit your teeth? Okay, good. So your eyes are, your pupils react, they're equal, they round and they react and to light and accommodate. Your mouth is pink, moist, no lesions, and good dentation, and your facial features are all symmetrical. So now what I'm going to do is I'm going to go ahead and I am going to lower the bed rail, and we're going to go ahead and have you sit up. And what I'm going to do next is I'm going to check your lungs. And so since you're an older person, you've had in the past histories of some lung issues, I'm going to start with your lower part of your lung area at the base of the lungs and listen to it first. Yeah, just breathe normally.
Just normally.
Now I'm going to listen up here on your right lobe. Okay, and now listening front. Okay. All right, so on your lungs, the lung sounds are good. They're even and unlabored. And the next thing I'm going to do is I'm going to check your heart area out. The first place I'm going to check is I'm going to check what we call, it's the aortic area. It's the second intercostal space. I'm going to check, it's right at the second intercostal space on the right side on the right sternal border. So I'm going to listen there first for a low dub. Okay, and now I'm going to go to the left side, the second intercostal space on the left sternal border, and that's the pulmonic area. I'm going to listen to that. And the next thing I'm going to do is going to go to the third intercostal space on the left sternal border. That's called Erb's Point. I'm going to listen for the low dub. And the next part I'm going to listen to is going to be on the left sternal border, the fourth intercostal space, and that's going to be the tricuspid area. and let's lift up. And the last place I'm gonna check the heart is gonna be the 5th intercostal space, mid-clavicular line, be under the breast. I can lift with the back of my hand or the patient can do it, and I'll listen for the lift up. Okay, so the rhythm is good, and I hear the love dubs. And the next thing I'm gonna do is I'm gonna have you lay back on your back. And I'm gonna let you kind of do a scrunch lean, bring your chest and your knees up together. There you go. And let you lay back flat. Alright, so the next thing I'm gonna do is I'm going to, I don't see anything out of whack. Your abdomen is round and no hernias that I saw. So now what I'm gonna do is I'm gonna listen, and I'm gonna begin to listen to the bowel sounds at the right lower quadrant. And I'm gonna start there and listen for bowel sounds. And then I'm gonna go to the right upper quadrant. And then I'm gonna go to the left upper quadrant. And then I'm gonna go to the left lower quadrant. Okay, and I hear the bowel sounds, so that's good. And the next thing I'm gonna do is I'm gonna percuss. Alright, and after that, I don't hear anything out of normal, everything sounds good. I'm gonna palpate 1 inch, no more. Anything deeper, a physician has to palpate. The next thing I need to know is if you have your bowel movement. When was your last bowel movement?
Yesterday morning.
Okay, good. And do you have any trouble urinating, any burning, frequency, urgency?
No, I don't.
Okay, good. So I heard positive bowel sounds. Everything sounds good on there. No masses or anything known seen there. Everything's good. The next thing I'm going to do is I'm going to check your arms for the temperature. See how they are. Okay, and then I'm going to check for edema. I'm going to press down. And then I'm going to check your capillary refills. Just give me your fingernails. And let me check this side. And then I'm going to check your radial pulse. Your radial pulse, the strength is good, regular rhythm, and 2+ strength. Okay, I'm gonna check and let you grab my fingers and squeeze, and I'm gonna let you push, and I'm gonna let you pull. Okay, now I'm gonna go to the legs, and I'm gonna check to see if there's any difference in the temp, to see if they're normal. I don't see any abnormal color, everything is good coloring. I'm gonna check for this edema, and that's over the tibia. No edema. And then I'm gonna come and I'm going to check your pedal pulses. Your pedal pulses are 2+. They're equal, okay? And I need you to pull, and I need you to push, and I need to check for capillary refills. And they are normal, okay? So no edema, temperature in your legs and arms are good, skin color's good, coloration, strength in your arms and legs seems to be good. With, like I said, no edema. So now what I'm going to do is I'm going to let you go ahead and roll on your side for me just a moment. Check and everything looks good unless you roll back on your back. So I don't see anything abnormal there, so I'm going to raise your bed rail up, and I'm going to lower the bed down, and I'm going to give you the call button. And if you need anything, give us a call.
Thank you.